Hi, this is Dr. Lili, and today we're going to talk about strep throat.
When the doctor says my child has a condition, I'll learn more at my pocket pediatrician.
Hi, this is Dr. Lili, and today we're going to talk about strep throat. So this talk actually comes at the request of Ashley. She was at the pediatrician recently with a child who didn't have a sore throat, but actually had a rash and a tummy ache, and the pediatrician wound up diagnosing the child with a strep infection. So she wanted me to talk a little bit more about that. So we all kind of know what strep throat is. Usually when you have strep throat, your child will complain about a sore throat. There's often fever. Sometimes you feel these little glands here being swollen. And if you look in the throat, sometimes you see the throat is really red. Sometimes there's pus on the tonsils. The child might not want to eat or drink. So that's kind of the classic picture of strep throat that you're used to seeing. There are usually several million cases of strep throat reported in the US every year. That's a lot. It's very common. You're not going to get through a year without at least one kid in your child's class coming down with strep throat, and there'll probably be a letter sent home, depending on how old the kid is. In preschools, they often will do that, or in daycares, saying somebody has been diagnosed with strep throat. If your child develops symptoms, take them to the pediatrician. So why should you take your child to the pediatrician? You know, it seems like a lot of times we're telling you, oh, it's just a virus, don't worry about it, your body's going to heal. The thing that's different with strep throat is, one, is that while those millions of cases of strep throat are pretty benign and nothing bad really happens, there are actually several thousand cases per year of what's called invasive streptococcal infection. So it can cause skin infections, it can cause other type of infections in the blood and the lungs. And so we don't want the infection to spread to become something like that. The other part to it is that the bacteria, group A streptococcus, can release a toxin, and that toxin can do some strange things to your immune system. So it can kind of put your immune system into overdrive, and what happens is then your body will start attacking itself. So a lot of people have heard of rheumatic fever. While rheumatic fever is not common, it can cause a lot of problems in the heart for people. So basically rheumatic fever is a result of having a strep infection that was not treated, and then your body goes into an autoimmune response and attacks your heart. The other thing it can do is cause something called glomerulonephritis, which is basically when the immune system attacks the kidneys. Now, treating the strep infection doesn't prevent glomerulonephritis from happening, but you should go ahead and treat it just because you don't want those other consequences. Does this mean that if your child has a sore throat, they should automatically get antibiotics? No. So a lot of the times, pharyngitis or sore throat or a throat infection is caused by a virus, in which case we would not want to treat with antibiotics. But that's why it's important to know. So your pediatrician would do a test called a rapid strep, or sometimes if you're in a hospital setting, they might do something called a molecular assay. But either way, they are going to swab the throat and find out if that streptococcal infection is present. If it is, then we would treat with 10 days of antibiotics. Usually penicillin or amoxicillin works great. It's really important that you finish those antibiotics. And if you feel better, you don't stop taking it. You take it all the way till it's finished. Now, why did Ashley's pediatrician check her child for strep when she didn't have a sore throat? There are certain things that can go with a streptococcal infection that don't involve the throat. Sometimes you have a rash, and we often will call it just a regular classic sandpaper rash. Basically, if you look at your child's chest, the skin will actually look kind of sandpapery, just very fine little bumps all over it. Sometimes it's itchy, most of the time it's not, but sometimes that rash is the only symptom. Sometimes strep can also give you a different rash than the sandpaper one, which is kind of a blotchy red rash that's sort of all over. It can be on the face, the hands, the arms, everywhere. And that rash is called Scarlet Fever. And that's the same toxin that the strep bacteria releases in the body can cause that rash to occur. So if your child has Scarlet Fever, they would be treated just the same as if they had strep throat. Sometimes we also see a certain diaper rash that has a very classic appearance for strep. So the importance of taking your child to the pediatrician, letting them do a good physical exam can't be overstated. Your pediatrician has spent years training for this. They know when they need to worry, what rashes are just kind of viral things and what rashes look like strep and would definitely need to be treated. Sometimes kids' only symptom is belly pain. A couple months ago, when flu season was kind of rampant, my 2-year-old had a fever and no other symptoms at all. Every now and then he would tell me my belly hurts, but that was it. And of course I was thinking appendicitis and other things, so I was constantly checking his belly and looking at him, but he went on for 3 or 4 days of just straight high fever and absolutely no other symptoms. I was thinking maybe he had a urinary infection, so I finally had to take him into urgent care because it was a Saturday. They tested him for flu, it was negative. They tested him for strep and it was positive. So we had our answer right there and we went ahead and treated him. And within about 12 hours of antibiotics, the fever went down. He was feeling much better. He started eating and drinking again. And, the next day he was a brand new kid. Strep is one of those things that's very easy to treat, but you have to diagnose it correctly. So if your child has a sore throat, has swollen nose, is not drinking well, has fever, then that's very likely going to be strep, and they should be tested and find out if they need to be treated with antibiotics. So don't be afraid to take your child in, have your pediatrician take a good look, and that way you'll rest easy, your child will rest easy, and you can get that antibiotic, and you can get your child back to school and feeling better. Newer studies have come out, because it used to be that you had to have at least 24 hours of antibiotic before you could return to school, and newer studies have come out and shown that actually you can go back after 12 hours. So let's say you start your antibiotic at 4 p.m., take a dose again in the morning when you wake up, and you're good to go to school the next day. So that's another guideline that's changed kind of recently, that you can actually go back to school after only 12 hours of antibiotics, that parents can get back to work sooner. They don't have to keep their kid home. Those 12 hours of antibiotics have given them enough coverage that the child's not going to be contagious to spread it to other people. I hope this was helpful. I hope you learned a little bit about strep infections. Please hit that little red subscribe button below. Let me know what you think. I'm sure a lot of you have had your children have strep infections. What did it look like? Did they get the rash? Was it just a sore throat? And how long did it take till your child felt better? This is Dr. Lili with My Pocket Pediatrician. Thanks for stopping by.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.